Live happy and healthy, my brother. Live happy and healthy, my sister.
I welcome you to this episode of Healthier, Older and Happier. The use of medicines is largely a personal affair. But when it comes to societal drugs, the use of medicine goes beyond being a personal affair to a public health affair. Perhaps you have never heard of the term societal drug. A societal drug is a medication which, when used by one person, has the potential to affect other persons and even large populations. Antibiotics are one example of societal drugs. Today, we will focus on 10 arguments that should convince you that your use of antibiotics goes far beyond you and could potentially affect someone else very far away from where you live. Argument number 1. Resistance of bacteria to antibiotics is not a serious problem. I wish this were true, but it is not. The truth is that it is such a serious problem that the World Health Organization projects that by the year 2050, up to 10 million persons will die every year from the effects of bacterial resistance to antibiotics if something is not done to stop the current trend of increasing resistance of bacteria to antibiotics. Argument number 2. I use antibiotics for my own benefit. I don't see why that should be a problem to anyone else. Self-medicating with antibiotics means prescribing antibiotics for yourself and using them without the instruction or advice from a competent healthcare provider. This definitely fosters overuse and misuse of antibiotics, which are major drivers for the development and propagation of resistant bacteria. Argument number 3. My body is not resistant to antibiotics, so I don't see what the problem is. There is a problem. First of all, there is no such thing as anybody's body becoming resistant to antibiotics. What happens is that bacteria become resistant to antibiotics, not human beings. The bacteria which become resistant to antibiotics are transmitted by human beings and other systems, including the animals and the environment, to places that may be very, very far away from where the inappropriate use of antibiotics that resulted in the generation of resistant strains happened. Argument number 4. Resistance to antibiotics is the result of repeated use of the same antibiotic. This is not necessarily true. Bacteria can develop resistance to antibiotics after single or multiple exposures. Argument number 5. Within a few hours of starting antibiotics, I felt better. That shows that I actually had a bacterial infection. This is not true. Indeed, the fact that you felt better within a few hours or within a day of starting antibiotic treatment may indicate that you actually did not have a bacterial infection. Argument number 6. The antibiotic the doctor prescribed is just not working. It's over 24 hours since it was started, and I still feel unwell. It may not be true that it is not working. In many conditions in which appropriate antibiotics are prescribed, it takes a couple to several days for the effects of the antibiotics to be clinically evident. So you would need to be patient to see the antibiotic effect kick in. Okay. Argument number 7. It is always safe to take antibiotics because they attack bacteria that cause diseases. This again is not necessarily true. Indeed, it is not always safe to take antibiotics. Antibiotics, like other medicines, always come with a bill, and the bill is not just about what it costs to purchase the antibiotics. The bill includes the side effects that may result from the use of antibiotics. These side effects may be mild or severe. They may be acute or chronic. Some of them are actually life-threatening. Someone very close to me had a close shave with death after taking one single dose of antibiotics. It was a frightening sight to see her skin peeling off, mouth, nose, bleeding. It was a terrible sight, not something I want to ever experience again. Apart from acute, life-threatening side effects, some of the complaints that many people may not attribute to their inappropriate use of antibiotics may actually be the result of antibiotic use. For example, chronic diarrhea, chronic frequent passage of stools, pains, aches in muscles and joints, tingling sensations of pins and needles in the body, the sensation of the heart beating faster. While these symptoms may actually be due to disease in specific organs, they may, however, also be as a result of side effects of chronic or inappropriate use of some antibiotics. Argument number 8. Injections are always more effective than oral medicines. So antibiotics should be given by injections for people who are really ill with bacterial infections. Fortunately, this is also not true, because it is possible to achieve adequate concentrations of antibiotics at the site where they are needed if given by oral route appropriately so. So you would need to trust your healthcare provider who is certified to prescribe antibiotics to guide you in deciding what antibiotic is required for what infection and by what route or route it should be given. Argument number 9. There will always be new antibiotics to take care of resistant bacteria. I really wish this were true, but unfortunately, one of the biggest challenges that we have is that compared to the rates at which multi-drug resistance is developing, the number of antibiotics in the development pipeline are very, very few. Add that to the fact that even for the newest antibiotics, there are widespread reports of resistant bacteria. And you would see how much of a public health challenge it is that we have several bacteria being resistant to common antibiotics, even the newest in the armory. Getting an antibiotic developed to the point of launching it in the market takes several years, sometimes decades. It's costly, and the pharmaceutical industry is not incentivized as a result of many reasons that make it not to be a profitable venture to develop new antibiotics, especially in the face of rising resistance that quickly makes those antibiotics ineffective. Argument number 10. I am not likely to change my behavior even after listening to all this, because I do not see how my use of antibiotics affects anyone else. That is the whole essence of this presentation. Antibiotics are more than that prescription with your name on it. Antibiotics are societal drugs. Your personal use affects someone else. The way you use the antibiotic that you have been prescribed, or your choice to use antibiotics without a prescription, determine how much we are going to succeed in promoting the fight against resistance of bacteria to antibiotics. Your use, appropriately or inappropriately, affects someone else, definitely so. So it is not just about you. Philippians 2:4 says, do not only look out for your own personal interest, also look out for the interest of others. In managing your symptoms, in prescribing medicines for your patients, in administering and dispensing antibiotics, in using antibiotics. We all are responsible to see that we steward the few effective antibiotics that we have left responsibly in such a way that the numbers of deaths, needless hospitalizations, needless prolongation of hospital stays arising from ineffective antibiotics because of bacterial resistance are drastically reduced.
Please subscribe to our YouTube channel. It's free. We'd also like you to stay updated on our content by hitting the notification button, and do please share with your loved ones. For more exclusive content, you could visit our website at aituaje.com, aituaje.com. We could also connect on Facebook, Instagram, Spotify, Apple Music, and Amazon. I look forward to seeing you next time. Bye.
Live happy and healthy, my brother. Live happy and healthy, my sister.